The answer is 10:30. Okay. Another client, intermediate acting insulin at 7:30. Same scenario with the emesis. When is this client most at risk? 9:30, 12:30, 13:30, or 21:30? The answer is 13:30. It is imperative that the client who uses insulin be aware of the potential for hypoglycemia. Signs and symptoms include jitteriness, diaphoresis, palpitations, weakness, confusion, and hunger. The client must be taught to ingest a food or fluid that will raise blood sugar immediately, juice, milk, or crackers, for example. Clients who will be administering their own insulin, it is important to include these nursing activities and assessments. Assess the client for any factors that might impede his ability to learn or perform self-care. Have the client monitor blood glucose levels 30 minutes before meals and before bedtime. Demonstrate self-administration of insulin, including equipment, technique, site selection, and site rotation. Provide information about the use of drugs that potentiate insulin, such as aspirin, alcohol, oral anticoagulants, oral hypoglycemics, MAO inhibitors, tricyclic antidepressants, and beta blockers. Teach the client to postpone insulin administration if breakfast is delayed. Make sure the client knows the signs and symptoms of insulin shock and DKA. Educate the client about the importance of maintaining the prescribed dietary intake. Emphasize the importance of following the prescribed activity levels. Let the client know that insulin needs change with stress, pregnancy, and illness. Now let's review a bit more about insulin administration by working through a few client situations. KW has self-administered 35 units of NPH insulin and 20 units of regular insulin at 7:30 each morning since her last visit to the clinic. She feels this regimen is controlling her diabetes well. She monitors her blood glucose levels inconsistently because she dislikes sticking her fingers and believes that she can feel when her blood glucose is not within normal limits. She takes in 1,300 to 1,400 calories each day, which includes an evening snack. Now let's answer some questions about that situation. How should she mix her insulin so that she can avoid 2 injections? She should draw up the regular fast-acting insulin first, then draw up the NPH or long-acting insulin. While this client has given herself insulin injections for years, many clients who have just had insulin prescribed for them have to be taught the skill. List the principles these clients should be taught about insulin and its administration. Clear, regular insulin is fast-acting and the vial does not require shaking. Cloudy insulin is longer lasting and the vial should be rolled between the palms before use. Insulin should be stored in the refrigerator when not in use, but injecting room temperature insulin causes less discomfort than injecting cold insulin. Each injection site should be at least 1 inch or 2.5 centimeters away from the previous site. Wash hands prior to preparing or injecting insulin. Clean the site with alcohol or soap and water before injection. A 50-unit insulin syringe is useful for smaller dosages. It is unsafe to bend, recap, or break needles. Dispose of them in a puncture-resistant container. According to the sliding scale on the screen, how much and what type of insulin will the client self-administer if her pre-lunch glucose is 180? According to this sliding scale, the client would receive 5 units of regular insulin. What are the most common reasons for hypoglycemia in clients who have diabetes? Drug overdosage, inconsistent or missed dietary intake, alcohol consumption, and exercise without snack compensation. It is crucial for the nurse who is caring for clients who have diabetes to understand what causes diabetic ketoacidosis, or DKA, how to prevent it, and how to manage it. Let's take a closer look at DKA. DKA is a life-threatening complication of diabetes resulting from severe insulin deficiency. In response to insulin deficiency, the body uses fats and proteins to meet cellular metabolic needs, subsequently producing hyperglycemia and metabolic acidosis. It is most common in clients who have type 1 diabetes, with undiagnosed diabetes, and in those who are not compliant with their prescribed treatment. Risk factors for DKA are infection, trauma, surgery, and MI. Other risk factors are interruption of insulin administration, noncompliance with insulin administration, noncompliance with diet therapy, and undiagnosed diabetes. For some, developing DKA is the first indication that they have diabetes. The signs and symptoms of DKA include any of the following: fatigue and weakness, headache, polyuria, dry mucous membranes and thirst, dehydration, Kussmaul respirations, that's deep, gasping, rapid breathing, dizziness, blood glucose levels higher than 300 milligrams per deciliter, blood pH below 7.3, serum ketones, urine ketones and glucose, abnormal levels of serum sodium, potassium, and chloride, hypotension, fruity breath odor, and central nervous system depression progressing to coma. Treatment of DKA includes administering regular insulin IV as prescribed to lower blood glucose rapidly, infusing 0.9% to 0.45% sodium chloride solution to correct electrolyte disturbances, giving potassium supplements IV, giving sodium bicarbonate IV for a pH below 7.1, finding and treating the underlying cause of DKA, monitoring lab results and blood gases, monitoring vital signs and urinary output, watching for fluid overload and fluid volume depletion, and watching for complications, particularly coma and cerebral anoxia. With early recognition and intervention, it is possible to reverse the signs and symptoms of DKA. Be sure to follow up with the client to address the cause and prevent its recurrence. Now let's look at some of the long-term complications of diabetes. Long-term complications develop because of persistent high blood sugar levels and the progression of the disease. Over time, high blood sugar levels from diabetes damage blood vessels and nerves throughout the body and increase the risk of eye, heart, and kidney disease. Damage to the blood vessels in the legs makes clients more likely to develop